And please join me in welcoming Phil Febbo to the stage. Phil.
Thank you.
So, Phil, you're the Chief Medical Officer at Illumina. I'd love to get a sense from the room. Does everybody here know Illumina? What's the level of knowledge? Just a few hands up.
I love it. Not a lot of hands up.
Yeah. Okay.
That's going to be different after the next 10 minutes.
Exactly. Well, so I think most people here are familiar with gene sequencing as a concept anyway. Illumina is the leading provider of gene sequencing platforms, right? Machines that actually sequence genes. Tell us a little bit more about that.
Yeah, and I guess I'd like to start as far as a segue, right? We've just gone through some very heavy topics, right? Food scarcity, first food security, malnutrition, hunger, health equality, and reproductive health rights. And now we're talking about sequencing. So everybody's like, why should I care about sequencing? And we'll get into the impact that sequencing has had during the pandemic, where it's hard to say that there's been a big success with 6.5 million deaths attributed to COVID. But what we'll get into is that toll would have been much higher. There would have been much more hunger, much less equity. And I think reproductive health rights would be under even more threat unless we had this technology. And so sequencing is basically reading the human, the DNA code, the code of life. We have 3 billion base pairs in our bodies, and that codes a lot. That's deterministic of a lot of our hair color, our skin color, and quite a bit of our health. COVID has a much smaller genome, 30,000 bases. And we were just thrilled to see our technology being pervasive enough and known enough to really step up when this pandemic arrived.
Just for people who might not be familiar, like there's been a trajectory of genomics, right?
Sure.
There was a point when it cost many thousands of dollars. What does it cost now to sequence a human genome?
Yeah, so right now it costs, about approximately $600 to 21 years ago, when the first human genome was published, it was about $20 million. So it's getting to the point, $600 is still out of the reach for a lot of individuals in lower middle income countries, but we're dedicated as Illumina. We've brought that down by 6,000-fold, and we're going to continue to push it down. So cost of sequencing is not going to be the limitation going forward.
Right. So I guess people who do know Illumina might know because of the sequencing you did of the COVID virus. And that allowed countries to say, hey, there's a new variant coming out, and to see where it's spreading. Now, we're all trying to learn the lessons of COVID. Yeah. It's not clear yet whether we really have, but I know one element of it is how do we get better at identifying pathogens earlier before they spread all over the world? That's something you're working on. I imagine it entails getting these sequencers, these machines in more places. How is that going? Tell us a bit more about that initiative.
Well, yeah, let me get to that. Let me first mention just a brief history of how sequencing helped with COVID, talk about a success story in Africa, and then talk about where we have to go. So before, in December of 2019, when respiratory illnesses were found in Wuhan, investigators were already taking samples, and we're very proud that our sequencers were used to sequence and identify this as a novel respiratory virus, most related to SARS and MERS, and give it the name SARS-CoV-2. In January of 2020, that sequence was made publicly available, and you had companies like Moderna now able, without ever having the virus in their lab, start working on a vaccine, start using their technology of RNA vaccines, and immediately use just that sequence to drive the spike protein in there, and they're off to the races. We also had companies creating point-of-care diagnostics right away, companies looking to repurpose treatments. So that started a cascade. And you're right, the sequencing then was able to track the virus as it spread. And there are multiple studies now showing that understanding the sequence of the virus and the changes that it accumulates over time really helped understand how it was introduced into communities much better than just through history taking or our phones. And it also identified these variants. And we were able to connect very rapidly the impact of the variants on our treatments, be they monoclonal antibodies or repurposed antivirals, impact on the vaccinations, the decreased transmissibility, impact on severity. And what was really incredible is that there were these, the pandemic did give us an opportunity to come together and break down barriers. And the Africa CDC led a pathogen genomics initiative where they recruited many stakeholders, including Illumina, but Bill and Melinda Gates Foundation, Oxford Nanopore, and Microsoft to enable investigators and laboratories within Africa to start sequencing the virus so that within the continent of Africa, they could track this. A month ago, investigators from across the continent published in Science 100,000 cases and mapped how the virus was spread through their communities. And Raj, that's how we get ready for the next one. So this pandemic brought the technology into a lot of laboratories and countries that didn't have it before. So just through African Pathogen Initiative, we introduced sequencing into 23 new countries, 43 labs, and we have a commitment to continue that. But now those sequencers don't only work for COVID. They can be used for tuberculosis, HIV, malaria, some of the biggest communicable killers. And increasingly, these same investigators, as they learn the technologies, they look at the opportunities, they can apply it to their own health issues. And increasingly in some of these countries, there are going to be non-communicable diseases that they want to apply to. Cancer, early detection of cancer. Imagine if we could leapfrog advanced disease and detect cancer earlier. There's a path for that. And that's incredible. And so it's now we have the existing infrastructure. We have to continue to develop that. We've made the technology approachable for these countries. But Raj, the importance of talking here and becoming better known is that our technology is one piece of the ecosystem. And it's really takes multiple stakeholders committed to support the laboratories, support the investigators in country, support the healthcare providers in country to create to sustainability. That's what I'm most concerned about.
And that's the classic story that many people in this room are very familiar with. An incredible technology is developed. Maybe it's a new vaccine. And you think, well, we did it. We've got this great vaccine. But of course, there's so many other steps to actually getting it into people's arms, whether it's health communication, public health, workforce training, et cetera. I imagine you face some of those challenges, right? We're talking about a machine that has a lot of capabilities. You may, as a company, say, we're willing to donate it or provide it cheap, but you got to get it to the right places. You got to train the people to use it. You've got to develop the systems around it. Tell us about some of those barriers and how people here might be able to play a part in helping solve them.
Well, when the pandemic hit, we were immediately committed to making sure that the cost of our sequencers or the cost of sequencing wasn't going to be a limitation. But as people will know, as by the count of the hands that were raised, we weren't really well versed in how to be effective in bringing technology into some of these countries. And that's why we had to work with entities that knew how to do that. Africa CDC was an incredible partner, and all we had to do is really support them. Bill and Melinda Gates Foundation has incredible experience with infectious disease, so we listened to them and really felt like we started to become part of this community. And that's where I saw the success happen, is those multiple stakeholders, because, I can tell you stories of, a shipment worth, millions of dollars sitting on a tarmac in continental Africa and losing cold chain. Because, the logistics. And, that didn't deter us. We sent more and maintained and had communication better. But unless you have the full system, it's hard to be a technology provider and have an impact.
We've talked a lot about equity today. I wonder if equity plays in at all in this space. Do you find that people might say, hey, these are countries that are so poorly resourced. Why are we even thinking about bringing genomics there?
Yeah, I think is an incredibly important part. Right now, there's a huge inequity in genomic sciences in that most of our knowledge of the human genome is the Northern European genome. And what's really exciting is we're seeing is across the globe, we're seeing more and more in-country sequencing moving towards raising awareness and including the genomes of diverse populations in our knowledge. And that's what we're going to need to draw upon in order to kind of pull that back to the health of individuals. So there's that. The availability we've seen when there's the will during the pandemic, there's a way for this technology to be available for lower and middle income countries. I think each of those countries have their own concerns, and sequencing is one part of a solution. But as I think about multi-drug resistant tuberculosis, multi-drug resistant bacteria, as I think about cancer and cancer becoming increasing concern in many of these countries, metabolic disease, there are more and more ways that these sequencers, once they're in the country, can be applied and used to help the health of the country.
Yeah, there's a big theme. We've covered it a lot at Devex, and I was yesterday with the head of the Africa CDC, and they're certainly very tuned into it, which is how do we bring the supply chain to the continent of Africa? And other low and middle income countries feel the same way. After they saw the hoarding of vaccines, the vaccine nationalism during the pandemic, they're saying, we want production here. But the other side of that is also the R&D before you ever get to production.
Well, we have to break the model. Genomics, the research model, has been mostly United States or European investigators going to lower middle income countries and establishing collaborations, and samples are shipped out of the country, or the fruits of those scientific efforts are mostly reported and attributed to institutions outside of the country where they work. I think it's now what we've shown during the pandemic, and with that article in Science, the top tier science journal, that when you move it in country, when you get that kind of engagement, that science can be of the highest level, but done in country. And we have to do that more and more. And that will create an ecosystem. It'll help in job development. It'll help in education, research, and it kind of feeds on itself over time. And it's not only in the service of science. There's clear paths where these countries that are now relatively, kind of moving along their concerns as far as whether it's communicable disease or non-communicable diseases, there's a path to leapfrog some of the challenges we have in, for example, in the United States, where we spend 16% of our GDP on healthcare because we're dealing with extremely advanced disease, including cancer, where if you can detect it early, you can treat in country, you can cure patients, better for the patient, better for the health system. And it's really through a path of technology like sequencing that you get there.
Right, and the key question, I think, and I know your CEO, Francis D'Souza, we've talked about this. He has a heritage from Ethiopia. He knows these contexts really well. The key question is, will these technologies roll out primarily in the richest countries in the world, and we'll wait a decade or 2 decades, or not? And I think that question is partly up to Illumina, but it's also partly up to this whole community.
Well, we're dedicated to do whatever we can. For example, we're moving away from cold chain. We're moving to ambient ship. We're moving to more sample to answer, so it doesn't take an incredibly sophisticated laboratory technician. Where we had some experience in the Democratic Republic of Congo during some Ebola outbreaks, where we were able to train field laboratories quite quickly on how to establish. And in fact, while they were tracking Ebola virus, there was a small outbreak of monkeypox, and they were actually to track that down and sequence it and use the technology, immediately adapt the technology. So the barrier is coming down. The cost barrier, the training barrier, and just the logistical barrier. And that's what we can do, but there has to be a collective effort and a collective vision of where is the value for those communities to make this happen. Because unless there's value, it doesn't matter the cost, the logistics. It has to bring value to the communities.
Well, thank you for that, Phil, and thank you for bringing the topic of genomic sequencing to the UHC stage here at Devex's Anga coverage.
Right.
Thank you.
Thank you, Raj.